This is a modified hip 90-90 position with a focus on the lead leg and external rotation. The modification for this position is really there to accommodate you if you're having a lot of stiffness in hip external rotation. So to get into the position, we assume it as a normal hip 90-90, so we're going to let both legs fall to the same direction. Now from here, you might be having a lot of stiffness in the hips. That's fine. Just first get your 90s lined out. And the 90-degree angles are going to be between your two thighs at your groin. So 90 degrees here, and then 90 degrees at your front and back knees. Now, a typical hip 90-90, you're going to be trying to sit as upright as you can, but be it stiffness in this lead hip or even stiffness in this trail hip, the modification is to lean away from this trailing hip, making sure you have a nice strong arm. If this is suitable for you, simply leaning away and you can maintain this position, but you feel the tension in the right places, hold this position. If you are still struggling just maintaining this, or your front leg is still way up off the floor, that's totally fine. Simply drop down to your forearm and then try to get your trunk as nice and as braced as you can. Don't let your trunk be saggy and lazy. Be strong through your shoulders, strong through your trunk. So this sideline position should accommodate this lead hip enough to allow that knee to really sink to the floor. And if you need some extra bracing, you take your top hand, brace the knee towards the floor. You will feel a lot of tension in this posterior lateral hip, sometimes even in the front of the hip a bit. But just maintain your brace of the knee into the floor and hold this position. As you continue to use this position, you may feel that it is much easier and you won't even need your hand to help your knee get to the floor. A real easy and quick way to progress this is to use some kind of bolster. I just have a rolled up towel, and you place that underneath your ankle and then get into the same position. Now you'll notice my knee is hovering off the floor a little bit. You can actively pull the knee back into the floor or help brace it with that hand. But now that the foot is elevated, it actually brings you further into hip external rotation. And then again, you would hold this position.